There is a chance that a disease similar to, or worse than the last pandemic, is spreading in China right now.
Concerns over another virus in China.
China's pneumonia surge that has mainly affected children is now spreading beyond its borders.
Hospitals across northern China are filled with families seeking care for their sick children. Some are waiting hours for treatment.
Chinese health officials are warning of a surge in respiratory illness across the nation that are primarily affecting children.
In November 2023, an alarming escalation in respiratory illnesses, particularly pneumonia cases, emerged among children residing in the northern regions of China. Startling reports indicated a sharp surge in affected youngsters, prompting significant concerns among healthcare professionals and communities alike. Notably, a prominent hospital in a major city disclosed an unprecedented influx of patients flooding their emergency room on a daily basis. Shockingly, they reported an average intake of approximately 1,200 children seeking urgent medical attention each day due to these respiratory ailments. This surge in hospital admissions highlighted the severity and rapid spread of the respiratory illnesses, causing widespread apprehension. The situation further intensified as schools in Beijing faced a substantial rise in absenteeism rates. Instances were observed where entire classes had to be dismissed for prolonged periods if even a single student fell ill. This situation eerily mirrors a past global health crisis, evoking unsettling memories.
A fast-spreading new subvariant of the coronavirus is raising concerns among health experts globally.
Let's now get you the latest from China. The COVID-19 outbreak in the city of Shanghai, the financial capital, has now reported more than 22,000 new cases in 24 hours.
They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus.
As of the present moment, an outbreak has emerged, characterized primarily by widespread pneumonia cases. The World Health Organization, WHO, has labeled this occurrence as a mysterious pneumonia outbreak, given the limited understanding surrounding it. Despite the urgent need for insights, there exists a significant dearth of information regarding this illness. The interesting part is that COVID also started as just a mysterious pneumonia outbreak. WHO persistently sought clarification and data from Chinese authorities regarding this respiratory ailment. Efforts to obtain crucial information have been met with challenges, as the usual cooperation from the Chinese government appears to be lacking. A recent tweet by the WHO highlights their repeated requests to China for essential details, including epidemiological and clinical information, as well as laboratory results pertaining to the reported clusters of this illness. The WHO's call for transparency underscores the crucial need for collaboration and shared information to effectively address and contain the outbreak. If you have watched all the way to here, don't forget to like, share, and subscribe to our YouTube channel. Your support helps us continue delivering timely information and insights. This current situation bears a striking resemblance to the period when China withheld crucial information regarding COVID-19, resulting in the virus spreading globally before effective measures could be taken. The parallels are concerning, as a lack of transparency and delayed sharing of vital details hindered global preparedness and response efforts during the initial phases of the COVID-19 outbreak. The World Health Organization, WHO, has released comprehensive guidelines aimed at aiding the Chinese populace in managing this outbreak effectively. These guidelines advocate essential measures such as maintaining a safe distance from others, especially when feeling unwell, adhering to self-isolation at home, undergoing regular testing, and ensuring vaccination against the illness. Additionally, the WHO emphasizes the importance of proper ventilation in enclosed spaces and emphasizes the necessity of frequent and thorough hand-washing practices to reduce the risk of transmission. Essentially, the recommendations from the previous pandemic are resurfacing once again. At present, there's a debate among Chinese experts about the need for widespread concern regarding this emerging mystery. They assert that it might be premature to plunge into a state of panic over a potential new pandemic. These experts propose that the global community should refrain from undue worry surrounding this situation. Their rationale pivots on the fact that November and December constitute the peak flu season in China each year. Additionally, with the relaxation of lockdown measures for the first time, people might be exhibiting heightened anxiety, rushing to hospitals at the slightest hint of illness. The surge in hospital visits could be attributed to overly cautious parents, still reeling from the trauma induced by the last pandemic. According to these experts, the strain on healthcare facilities might primarily stem from this cautious behavior rather than a dire health crisis. However, there's a striking similarity between this explanation and the narrative propagated by the Chinese government during the initial stages of the last pandemic. Critics highlight that this echoes the government's attempts to quell public panic previously, downplaying the severity of the situation. It appears that lessons from past mistakes have not been absorbed by the CCP, and transparency continues to be elusive, both to other countries and media outlets. If this situation were to escalate into a pandemic akin to the previous one, the global response and success in managing the crisis would once again heavily rely on China's cooperation and transparency, a factor that seems uncertain given the current state of affairs. A comparable outbreak, dubbed the white lung syndrome, is currently being reported in the USA, Denmark, and the Netherlands. However, no definitive evidence links this outbreak directly to the situation in China. The resemblance between the two outbreaks remains striking, yet conclusive connections are yet to be established. In 2019, just before COVID-19 breached China's borders and spread worldwide, ProMed, an international disease surveillance platform, issued a warning about an unknown virus originating in China. Once more, ProMed raised an alert regarding the ongoing mysterious outbreak within China. The timing of this viral occurrence is undeniably ominous, especially considering that both the USA and India, influential nations that played pivotal roles in managing China's actions, are on the verge of major political elections in 2024. The seriousness of this situation has not escaped the attention of numerous U.S. officials. In fact, 5 senators have urged President Joe Biden to swiftly impose a travel ban on China in response to this emerging health crisis. This call for action underscores the gravity with which these officials are approaching the situation, emphasizing the need for immediate measures to mitigate potential risks associated with the outbreak. In conclusion, the unfolding events surrounding the mysterious outbreak in China bear unsettling similarities to past crises, prompting concerns among global health organizations and governments. The lack of transparency and echoes of familiar patterns in managing information evoke apprehension about the severity and possible ramifications of this situation. As this unfolds, staying informed and vigilant becomes crucial in addressing and containing potential threats to global health. For more updates and in-depth analysis, don't forget to like, share, and subscribe to our YouTube channel. Your support helps us continue delivering timely information and insights.